Harris or good foot, just to give you an appreciation more or less upside down of what it should look like. That's what she was walking on. This is 1 week post-op. I guess things to point out is this area right through here. You can still see that there's a gap slightly. Subchondral bone plate still hasn't diminished, if you will. 1 week post-op, much better alignment, right? There she is at 4 weeks. She is fully weight-bearing and in a boot. And check this area out here. I packed this. This is called the sinus tarsi, and I just packed this with osteosome. And this is at 4 weeks post-op. And at 5 weeks, look at how that's filled in. It's filling in. It's becoming more opaque. When you talk about how fast can you get bone, I mean, the limit of light is, what, 386,000 miles per second? But for bone healing, I'm thinking that when you tell people it takes 6 weeks for it to heal, I'm saying it can heal faster. I'm thinking that there are variables there that you can control in the post-operative period that can really enhance things, and the type of material that you put into it, obviously. So this is what stem cells are doing for this particular individual. And again, this is at 5 weeks post-op. Take a close look at that gapping I used to have. It's not there. It's not there anymore. And of course, this is this is just, bragging rights, I guess. But anyhow, Liz Frank, this was a nightmare. This was a 60-year-old female, and Liz Frank, again, is the tarsal-metatarsal joint. And I did a fusion. She had a bunionectomy, but she also had arthritis at that same joint, so we ended up doing the fusion, the bunionectomy. And we thought things were going well. I did use a bone stimulator on her because I felt she was a little bit higher risk, and she went on to a ligotrophic non-union. At 7.5 months after I had to do a revisional surgery, I used Trinity, I guess it was, and she was on hormone replacement hypertension. In retrospect, I probably should have checked her vitamin D levels as well. The original surgery, and I didn't skimp either. It wasn't as if I didn't try. But there was demineralized bone matrix putty, platelet-rich gel. She was casted non-weight-bearing, and she had a bone stimulator, right? She was partial weight-bearing at 6 weeks, full weight-bearing at 8 weeks, and about 10 weeks later, at 10 weeks post-op, she felt a little clicking, but it didn't really bother her much. She went back to regular shoes. At 18 weeks post-op, I saw some problems. She had pain and swelling. I put her back into a cast, put her bone stimulator, and it did not work. So here she is. This is the pre-op, large bunion. But there's arthritis here. There's no joint space left. That's very painful. So the decision was made, let's fuse it. This is a standard fusion, if you will. And that's at 6 weeks after surgery. It doesn't look too bad. It looks like it's beginning to heal. That's why I didn't really fully weight bear to 8 weeks. I wanted to wait a little bit longer, let that heal. This is 5 months. That's a nightmare. When you have a patient like that in your office, they come in and they've got a painful swollen foot and it's kind of collapsed. This doesn't look the same and it doesn't feel the same, and you see this on your x-ray, you've got trouble. And of course, she's even lost a little bit of arch height because of this. Now this is not pretty. She's at 7 months. We tried the bone stimulator and it's just not going anywhere. In fact, it's even getting worse. Nothing seems to be working. So I took her back. Yeah, this is quite the construct. And there's my cervical plate, and I've got transfix screws, and I've reinserted some of my compression screws, and I fused these joints as well to try and incorporate blood flow from adjacent bones to try and get this thing to heal. And again, not the prettiest thing, but check this out. This is 11 weeks, and she's fully weight-bearing, and that's fusing, and the process of fusing, and look here, it's looking really quite good. And so we've got bone across those sites, and 13 weeks out, and there you have it. This fellow works for American Airlines as an executive. He had bad arthritis at this joint, tightness in the Achilles tendon, and so did a triple arthrodesis with a gastric recession on him. And there's his 1 week, and I don't think I've got the film, but it doesn't play. I wish it did. Of course, he doesn't say much. He's silent Bob. But anyhow, here's the thing. At 7 weeks and 2 days after his triple, he walked in wearing street shoes for his follow-up visit. Yeah. Wearing street shoes. That was the fastest. That was a record breaker right there. Here he is. His bone healed faster than his skin. I had a lateral dehiscence that hadn't healed up yet. Maybe I can use stem cells for that in the future, right? But the point is the bone healed even faster, and of course there's very little swelling. There's minimal scar tissue. He's looking really good. And trust me, he's walking really good here at 7.5 weeks too. So that video doesn't work just as well. They gum us up. Here's a 67-year-old female. Again, same story. Bad bone, osteoporotic, arthritic, collapsed arch. There's the talus. There's the rest of the foot. Walking on the medial ankle. This is 3.5 weeks post-op. Can you tell me what type of procedure you had?
Triple arthrodesis.
And about how long ago did you have that procedure?
3.5 weeks. Okay, and how's it feel?
Right now it feels great. I'm in the shoe, which is wonderful to be out of the cast,
Okay.
and no discomfort, and I can walk.
And how long have you been walking with weight on the foot?
About a week and a half.
About a week and a half, so you were non-weight bearing for about 1.5 weeks now.
Right.
Okay, so here we are 5 weeks post-op, looking pretty dang good. All right, 10 weeks post-op. And you can see at a 67-year-old, that's fused. That's fused. And she was fusing it obviously before that. I had signs before that. And that's what she looks like 15 weeks out. If you remember that view before where the talus was kind of off to the side.
Is that normal, I'm assuming?
That is normal.
Okay.
That is normal.
How much walking should I do?
Well, right now, I don't really want you on it more than, say, 10 minutes per hour.
Absolutely.
And so if you can kind of take it easy. But you've had this procedure done about 3.5 weeks ago. You've been walking for about a week and a half. You're just now in a boot. It's going to take a little bit while for this, of course, to heal up, but you're not having any discomfort to speak of, other than a little bit of pulling.
No,
and,
a little bit of pulling in the tendon. Other than that, I have no discomfort in the ankle or the foot.